Thank you. Okay, so welcome everyone to our webinar on multicultural perspectives on advanced care planning. We're very pleased that you could join us today to discuss this really important topic of not only advanced care planning, but how we bring cultural diversity and how we include that within our advanced care planning conversations. I'm Helena Rohde. I'm the Acting Program Director of Advanced Care Planning Australia. And I'm very grateful to have Selene, the Strategic Partnerships Manager for Multicultural Communities Council of Illawarra, present with me today. So thank you, everyone. Thank you, Selene. So before we get started, I'd like to acknowledge the traditional custodians of the land on which we meet today. I'm on the land of the Wurundjeri people, and I'd like to pay my respects to their elders past, present and emerging, and extend that respect to any Aboriginal or Torres Strait Islander people who are here today. We will also be recording this webinar, and it will be available on both the Advanced Care Planning Australia YouTube channel, as well as the Multicultural Communities Council of Illawarra page as well. So just to acknowledge that this is a joint partnership between MCCI and Advanced Care Planning Australia. Advanced Care Planning Australia is funded by the Australian Government and administered via Austin Health, but we're very grateful to be collaborating with the Multicultural Communities Council of Illawarra today. So thank you. So we'll have your attention for hopefully just under an hour, and really during this time what we would like to do is to be able to get you to explain advanced care planning, the legal and ethical frameworks and its importance in patient-centred care, but really focusing on people from culturally and linguistically diverse backgrounds. We also want to explain the concepts of culture, and Selene will provide an overview of the CALD Awareness Project as well. And then we'd like to get you to take that information and really be able to describe what the role is for health professionals, so in your own work for advanced care planning, and communicating with individuals, families and the team in a culturally appropriate way to support advanced care planning. So we thought we would just start with what is advanced care planning, and that really is the big question, isn't it? So on the screen you'll see the formal definition of advanced care planning. So it's a process of planning for future health and personal care where the person's values and preferences are made known so that they can guide decision making at a time when they might not be able to make or communicate their preferences. So that's the formal definition. But really, as a clinician myself and having that background, I know that it can be a really complex topic to try to explain to our clients, to our patients, to their families. And so really, I like to break that definition down into three main questions. And I always ask people, so if you weren't able to make or communicate your own decisions, who would you want to speak for you? So who is that person? What would you want them to say? And do they know what you would want them to say? And that takes that really sort of complicated definition of advanced care planning and really simplifies it. And that's really helpful for people from culturally and linguistically diverse backgrounds as well, to be able to really simply explain and ask them those questions to engage them in the process. So Selene is going to also talk to us about culture.
Yeah. Thank you, Helena. Thank you, everyone, for attending today's webinar. So I just would like to acknowledge the traditional custodians of the land. I'm on the Darawal country, and I think that today is the National Sorry Day, is an important acknowledgement, mistreatment of the Aboriginal and Torres Strait Islander, the people forcibly removed from their families and communities. I just would like to acknowledge that day as well. So when we say culture, I think that you can write down on the chat, I can see. So I just want you to think about these questions a little bit, have you visited another country? Can you speak another language, or do you eat food from other countries? So if you think about it a little bit, and if you like, so please put on the chat. And I think, Helena, you're able to see the chat, so maybe you can help me with the answers, and I'll just give like maybe the 30 seconds, and I'm just waiting for your answers. Like, have you visited another country, or what the cultural food you like? So just giving a little time to you. So, and then I want to a little bit interactive with you as well. You visited the Greece and Lebanon and Sweden. That's good. Yeah. So you eat some multicultural food. Yeah. A lot of questions. Yeah. So a lot of answers. So when we see, like, when we are thinking about these, the self-reflection questions, like, we can see, like, there are in many different ways. Like, we either come across like people from the different backgrounds, or we experience different traditional cultural food, or sometimes like we are coming from the different the cultures, and we are able to speak the other languages. So even though like we might not be from the multicultural background, like we still come across like the different people from the different cultures, especially in Australia. So when we look at the census, so Australia is the most multicultural communities in the world. So we are come across like with the cultures in any different way all the time. So, but like when we are thinking about culture, so maybe we can move to another slide, Helena. So when we are thinking about the cultures, like we just need to look at the different dimensions as well, because the culture is an umbrella term which encompasses the social behavior and the norms and found in the human societies, as well as knowledge, beliefs, or arts, capabilities or habits in the individuals or in the groups. So when we look at the culture or the working, or like with someone from the multicultural background, or maybe you are delivering services like to someone from the CULT background, culturally and linguistically diverse the background, we always need to think about these the dimensions, like primary dimensions. Also, these dimensions known as the visible culture, things such as like how we are, or clothes, or like what kind of music we are listening, or what kind of the food we are eating. And then when we look at the secondary dimensions, they known as less visible culture, things such as or attitudes, or communication styles, or how we are expressing ourselves, or emotions, or beliefs, or values, and or personal space. So like you really need to think about it, there's some of the, like when you look at the persons, that you need to look, there's some visible and then invisible dimensions. And we can move the other slide. And then other important dimension is which can play important role when we are working with the CULT background, the cultural and linguistically diverse background individuals. So when we look at here, so there is a universal dimension. So it means how this person like all others. Like, for example, every person needs the basic food, shelter, is like, you might know the Maslow's hierarchy of needs. And then when we look at the cultural dimension give us like how is this person some like others? Like, for example, the people coming from the same country both live in the refugee the camps, and then they experience the similar the things. But like when they arrive to Australia, they may respond the environment or the adaptation differently. So like when we look at the individual the dimensions, so individual dimension give us like how this person like no other, like your preferences are unique to you. For example, you might working the 5 members from your the workplace, like the Muslim background, and then 4 of them might be the practicing religion regularly. So it means like they may need to pray a room in the workplace, but this like the one of them may not practicing religion as others. So what we can see here, like if we focus only cultural dimensions, that we might not get enough information about the person we are working with or we are delivering service. So if we want to focus on the inclusion, we must include the individual dimensions and ask the question, how this is person like no other. So I'll just leave it with you, Helena.
So thank you, Selene. And really, when you think about the foundations of advanced care planning, it does really tie in with what those cultural aspects are and all the things that we need to consider. So it is person-centered. It's about considering all of those dimensions of their culture. So what might be universal, what might be similar to other people, but also what is really specific to them and how it can be different and how that might impact on the care that they want, the medical treatment decisions that they want, rather than assuming that they are similar to other groups, what really is individual to them. And that's what we try to capture in advanced care planning. It also captures their goals, beliefs, values, and preferences. So these might be influenced by their culture, it might be influenced by their religious beliefs, by where they were born, by the communication style that they prefer within their culture. So all of these come together as part of advanced care planning. And it is an ongoing process. So it's not something that we ask somebody once and we assume that, that's it, it's set in stone. These are things that we continue to ask them, to involve them in these discussions. It's an ongoing process. And things change. The way people respond to things can change based on the situation that they're in. And there's certain cultural backgrounds who might respond in a certain way at diagnosis, and then as their condition changes, their thoughts, their beliefs might change, their practices about what might happen at certain time points along that journey. So it's really important that we revisit that and that it's an ongoing process of communication. And all of this is really encapsulated in a legal framework. So it is supported by law, and that's really good to know, not only to really guide your practice, but when we give this presentation to health professionals, sometimes we can have family and particularly with cold groups, sometimes the concept of advanced care planning can be a little bit daunting when you're asking somebody about what their preferences are for medical treatment. So sometimes families might say, why are you asking mum these questions? Or why are you asking dad about what treatment he wants or doesn't want? So it's really important for you to know and to be able to say to them, legally I have to ask these questions. This is my role to do this. This isn't any different, and be able to really guide them through the process and help them understand that it is a legal aspect and it's a part of you being able to do your job as well as a health professional. So the benefits of advanced care planning, really we know there are known benefits to participating in advanced care planning. It's that people are more likely to receive care which is consistent to their preferences, reduced hospitalisation at the end of life, that the person will die in their preferred setting, and reduced stress, anxiety and depression in surviving loved ones. So sometimes it can be complicated, especially with people from culturally and linguistically diverse backgrounds, to get them to engage in the process of advanced care planning. So I found that there's a few common hooks that people will engage with. Firstly is thinking about advanced care planning like an insurance policy. So I often say to people, we insure our house, we have car insurance. We don't do that hoping that we're going to have a car accident. We do that, hoping that we'll have the best case scenario, but just in case we do, we've got that backup plan. It's like advanced care planning. It's an insurance policy. We don't write down our wishes hoping that we're, going to die soon or that we're going to not be able to communicate our decisions, but we write them down as an insurance policy. Just in case this happens, I've got this backup plan here. And that can be sometimes a more palatable way for people to engage or accept these conversations when we link it to that insurance policy, because there can be a little bit of stigma around talking about death and having those conversations. Another really important hook is talking about family and loved ones, and often in quite a lot of backgrounds, the family is really the centre of their culture and what is really important to them. So talking about what that burden would be like, do your kids know, what would it feel like for them? Do they know what decision they'd make? Do they know what your choices would be? And reducing that stress and that anxiety for family can be a really important hook to get people to participate in the process for themselves.
Yeah, and then when you look at the multicultural communities, especially they're working with, like, because like in my departments, I'm working so mainly like the 65 and over. So the understanding about the advanced care planning and advanced care directive is a little bit different. So in 2018, the Multicultural Communities Council of Illawarra partnered with Coordinate, the Southern New South Wales Primary Health Network, so to create awarenesses about advanced care planning and establish community engagement initiatives among the CALD communities, culturally and linguistic diverse, the communities in Illawarra, Shoalhaven, and the partly in southern tablelands of New South Wales. So like in all initial sessions, so we ask individuals, the older, the people coming from the multicultural background, what is advanced care planning? And almost everyone confused it with writing their will. So they find out that they were just thinking it's or that they're going to write their wills or their finances or the plans, like what's going to happen after they that. So most this concept meant like that they want to know like what's going to happen after they die. So we started to demystify the concept by explaining what is advanced care planning and what is living will and how is a different form of will. So we explained that advanced care planning is a process, like think about your values and what do you want about your the medical treatment, and then talk about your loved ones or like, you know, like when you look at the multicultural communities, the GPs or the doctors, and or there's someone like from the clinical background that have a like important role in the community. So maybe you can talk about them with your GP and then record about your like future healthcare and then preferences and values. So it helps for you to have some voice in the futures if you're not able to speak for yourself. So we explain about advanced care directive as well. This is a document that records your instructions about your future healthcare or your medical treatment. And like we just, you know, like it's again, the confusion is continues, like what is advanced care planning, what are the differences with advanced care directive, so what are I going to do with that paper. So like when we say it can be completed like with everyone the 18 years old and over, and then you don't need to be diagnosed with the terminal illnesses or you don't need to be age only. So we inform that advanced care directive it's not a legal document in New South Wales. So it gave them kind of a comfort. It's like you see here, like in some cultures, like people are apprehensive of lawyers or any kind of the legal and administrative matters. However, so we do advise, you know, like that they can see their lawyers and that they can add advanced care directive into their will as well. So we provided information like they can choose, they put their choices and options in the advanced care directive. So we also be explaining like it's been different in every state. So, and then we just advise them to see their GPs. It's important, but of course it's not compulsory. But the GPs can help you to certify that they like your state of mind, and then verify that you are not being forced into writing advanced care directive. So it's so when you look at the multicultural communities, like you just need to think about lots of the details as well.
Thanks, Selene. So it's very interesting to hear about what people think advanced care planning is and the advanced care directives. So as Selene said, that people from multicultural backgrounds often do confuse it with being a will, but it's not. It's all about living and living well. And I think having that positive reinforcement about this is about your values and what quality of life means to you is a really nice way to introduce it as well and to frame those discussions. So the most important thing about advanced care directives to know is that it's a document about somebody written about themselves for themselves. So I write my own advanced care directive. That, you know, my daughter can't write my advanced care directive for me, that it's a document about me that I complete for myself. And some of the questions, the common questions we have related to culturally and linguistically diverse groups is, does it need to be written in English? And yes, it does, because health professionals who are reading those documents, enacting those documents, making decisions need to be able to read it and access it. So It does need to be written in English. It can certainly be translated or supported, so somebody can translate the document for somebody or assist them in writing it in English, so they're able to verbally say it and somebody can document it for them in English. So that's a really nice way to do it with an interpreter translating the document, and then the person signs and so does the interpreter, but it's very important that the person signs the document themselves, but it does need to be written in English. So the other thing is that it is legally binding and that each state and territory has its own forms for documenting. So on the screen, you can see the Victorian form, an example of the Queensland form, and the New South Wales form. So they are all there. Now, what can actually be included? So all the forms are slightly different across each state and territory. So I think we've all learned recently that the state and territories don't agree on much, and advanced care planning is not immune to this. So what can be included in the forms is people are able to answer those 3 questions that I mentioned at the beginning. So who do I want to speak for me? So they're able to appoint what we would call a substitute decision maker. And this is called a different role in each state and territory, but the national terminology is a substitute decision maker. So they're able to appoint somebody to speak on their behalf. They're also then able to document their values and preferences. So these are the general values that people have and they want decisions to be made on. So for example, it might be, I would not want life-prolonging treatment if I'm unable to recognise my family and friends. So it's those core values of what's important to them. I wouldn't want life-prolonging treatment if I was unable to mobilise independently. So really thinking of those core values of what's important to someone, and these will be different, obviously, for different people. And then, and they're not legally binding. They're a guide for their decision maker and for health professionals, or for us as health professionals to make decisions upon. So those values and preferences are legally binding. And then they're also able to leave specific medical treatment instructions. So these allow them to consent to, refuse, or withdraw from any treatment. An example of this might be, I do not want blood products or infusion of blood products under any circumstances. So it's very clear what the treatment is and what they would refuse from. This is a legally binding section. So as health professionals, we have to abide by the instructions in these sections. That can often be really daunting for people, especially if they don't have a particular condition, or if there isn't a particular treatment that they want. So it's really important to know that even though the form has all of these options available, that they can really pick and choose what they might want to participate in. So they might want to appoint someone and document their values, or they might only want to leave medical treatment instructions. So it's up to the person about what section of those forms they want to fill out. They don't have to complete the form from start to finish. They might leave gaps in there. And as Selene mentioned, these forms can be downloaded straight from the Advanced Care Planning Australia website. They can just be witnessed. You don't need to go to a lawyer to have these forms done or pay to have advanced care planning done. It is free, and there are lots of resources that can support that.
Thank you, Helena. So, but important thing is, like when we are working with the people, like individuals from the different backgrounds as well, like we really need to understand like we are just talking about the person-centered approach. Like we just really need to move from the one-size-fits-all attitude to customize to suit particular individuals' needs. So, and that because of that, the education of the cultural diversity is important. So that one gives us the person-centered care that benefit to each individual. So when we are working with individuals, like we really need to look at maybe they are coming from the different religions, and then now they are looking at advanced care planning, or like any medical treatment or the life treatment, like illnesses as well. So like we just need to look at their religion, the backgrounds, and also their history. So importance of engaging the individual's history, like that we can start thinking and they're being more conscious about their history as well. So like are they coming from the world conflict, or the political war, or the reason for migration is really changing the individual's perspective as well. So we can just move the other one, Helena. And then, you know, like when we are talking about the person-centered approach, like decision-making is the very important process, like in advanced care planning and advanced care directives. So because which might different from culture to culture, family to family. Today, like we are giving a general information, of course, about the cultures, and it depends on the individual person to individual person. So, but in cross-cultural healthcare situation, professionally, we might already know like what questions we might need to ask. But it's important to ask how we are asking these questions. It's very equally important. Like we need to understand that person, you know, like we're just talking about the primary and then secondary dimensions, the universal and then cultural dimensions as well. And also the person is coming from the high or the low context culture, like they are from the collectivistic culture. It's like when I'm saying collectivistic culture, so the one that based on valuing the needs of the group or the community over the individuals, like the kinship, family, or the community are extremely important, and the people to work together and then create a harmony and then group cohesion is extremely valued. Like for example, again, I'm generalizing, but in African countries, the people are focusing on the needs of the family instead of their individual needs. But when we look at the individualistic culture, low context culture, the society is characterized like with individualism. So they place in high value on independence and favoring individual rights over communal goals and equal power sharing across the culture. So communication is direct and specific. So by saying this, there are people who come from the low context cultures, but still consult with their family and their community maybe. So again, like we really need to understand how we are asking the questions and then like who we are dealing with. So to understand the individuals, like what their perspective about advanced care planning or advanced care directive. So like, for example, asking questions, what do you want? What do you think about your values? Like just identify their values with them, or who do you want me to talk about the medical care processes, who you would like to involve, like, or when do you want to involve the family members? And or if you're consulting with family members, like I don't know, like you might need to ask the questions, how can I, like, we can refer the sickness, like because it's really changing the decision-making process as well. So for instance, like in Indian, the families are large and in size and living with extended families. For additional support, and often the preferences is that the decision making is made by the male or the senior of the family, so due to male power of role, or like in some cases if the female not able to speak English, so they are dependent on their husband or the male member of the translate, and then they're like highly involved in the decision making. So you might need to really identify like the decision-making process with the individual, and then including their circle and then families into that. And we can pass to another slide. So like, again, like I just continue with the project, like we started, like we are still continuing with the communities, like raising awarenesses. So now the most of the people, like we come together, like since 2018, I don't remember, maybe more than 1,000 people, like we just they bring the information, and they know like what is advanced care planning or the advanced care directives. Like still they are thinking about, like they're gonna fill out the advanced care directive, but what we done and like why we success. So like first phase, like we just create awarenesses in the cold communities about advanced care planning and advanced care directive, and to direct anyone the caring for them. And then like we just mentioned that when they are not able to speak for themselves. And then we identify the barriers in the cold communities in discussing end-of-life care. In the beginning, like Helena mentioned, in some cultures, the people don't talk about that or the sickness, or they don't, like, for example, they don't say cancer, they just say C word or that disease. So we just identify this kind of the details and then barriers, like with the individuals and then communities as well. And then we promote advanced care planning via or the team talk record strategies to cold communities, and also service providers the supporting these communities across Illawarra and Shoalhaven. And we're just going to see some of the videos, like we develop animations and then videos, and then we included community members in that project as well. So how we did it, like the leveraging or existing expertise in culturally appropriate service delivery, and through our established network and links to cold communities, service providers and other stakeholders, we were able to increase awarenesses like within all communities about the importance of planning ahead for their care needs. And then we did engagement with seniors, like from the cold backgrounds, their family members, friends and carers, and other community members in the region. So, and also we built capacity of all the staff and volunteers, like with training, information sessions. And I'll just talk about a little bit about the end of the session about the virtual reality technology to make them like became ambassadors about the advanced care planning, and then promote this to their respective clients, so that people from the cold backgrounds take steps and complete the advanced care directive. So yeah, so far, again, as I mentioned, it's like we just done like more than 60 like information sessions like with other organizations, and also like we reached like more than 600 people, like individuals in the communities, and to raise the awarenesses. Right, Helena, it's on you.
Thanks, Helen. Such a wonderful project, and such a great way to engage the communities and build that awareness. So often people have to make really complex decisions, and it's hard to know where your line in the sand would be and what decisions you might make. So I'm just going to try this little exercise for us to consider. So the first, I'm going to give you a little scenario and then have a think about where that might be for you. So you can just pop in the chat a number between 1 and 5. So 1, much worse than death. 2, somewhat worse than death. 3, neither better nor worse. 4, somewhat better than death. Or 5, much better than death. So feel free to pop your responses in the chat. So the scenario is you're permanently unable to communicate in a meaningful manner. You cannot converse with others, and you cannot remember your family members and close friends. You can walk on your own, feed yourself independently, and can take care of your daily needs, such as bathing and dressing. So where might that be for you? 1, much worse than death. 2, somewhat worse than death. 3, neither better nor worse than death. 4, somewhat better than death. 5, much better than death. And I see quite a few responses. Thank you to those that have shared in the chat. And just scrolling through, we have people across all of those responses from 1 all the way to 5. So we are all different. And have a think about what has made you choose where you are and why you might have made that choice. So a lot of that might be based on your culture, your background. Some of that might also be based on your own personal experiences. So I know for me at this point in time, I would be a 4 on the scale, somewhat better than death. And that's because I have 2 young children, 2 young girls, and being a part of their lives and watching them grow is really important to me. So even if I wasn't able to communicate, I'd still like to be there to support them and watch them grow. And I said that once in a presentation, and somebody said to me, that's the exact reason why I'm on the other side of the scale and why it's much worse than death, because I was caring for a lady and she wasn't able to communicate. And every day I would watch her children run past her, and it's like she wasn't there because they really needed that communication. So it's our culture, it's our background, it's our experiences, and it's all of those things that really determine what quality of life means to us. And it's all of those things that we need to consider for the people that we care for as well, and when we're trying to help people through that process. So reflect on why you've chosen where you are and what's led to that as well. Have you seen something? And how can we engage our own clients in these conversations to help them identify what their values are? Even though we encourage the completion of advanced care directives as being important, it's also really the most important thing is the conversation, and is having those conversations with family as well and with our loved ones. So even if it's not filling out the directives, having these conversations is a crucial part of the process, and thinking about these scenarios and having those discussions is really important. So we're now going to watch a video, as Selene mentioned, that was developed as a part of the project on a culturally appropriate approach to advanced care planning. So a little animation. These come in a variety of languages. We're just going to show the one that's been translated in Vietnamese as a bit of an example.
Did you ever have the conversation?
No. Advanced care planning. Think about, talk about, and record preferences for future healthcare. Do you know what advanced care planning means? Would you know what treatment choices and decisions to make for your loved ones?
Mum, we need to talk about what you want to happen in case.
I don't care. Let God decide.
Mum, we need to talk about...
Are you saying that I'm going to die soon?
Dad. Shh. No need to talk. What is meant to be, will be.
For a range of different reasons, we know our parents don't want to talk about it. But advanced care planning is important. It's different to a will. If your loved one becomes seriously ill or injured and can no longer make decisions for themselves, who would speak for them? Do you really know if your loved one wishes to be kept on life support? Would they prefer certain healthcare treatments? Do you really know what they want? Without advanced care planning, the responsibility falls back on the family to decide. And this can cause a lot of stress, anger, and tension, especially if family members want different things. Don't leave it till it's too late, and don't be left in a difficult situation. Start the conversation by sharing this video with the people you love.
A great video that really highlights the importance of the conversations, but also some of the barriers that we face from people with culturally and linguistically diverse backgrounds. Leave it to God, whatever will be. And they're not necessarily just from people from culturally and linguistically diverse backgrounds. We hear that from a whole range of people. So thinking about how we can encourage people to have the conversation, linking it to the insurance policy. Let's have this conversation, let's put it away, then we don't need to, think about it again. It's just really important that we know. Sitting down and maybe talking about the whole family, not just the parents or the older person, but how it can be a whole family approach, how the younger people can share what their wishes are. And, we've all seen that, we've all stood by the bedside in intensive care of young people that have had car accidents, strokes, obviously not planned, but lots of things happen to people from all age groups. So how it can be that whole family approach where everybody participates in the process. And encouraging those conversations and what it might mean to family if they're not had as well. So a great video. Thank you to Selene and the team for producing that. So how do we start the conversation? So we do have a range of conversation starters, and it's not just about let's do our advanced care directives, let's all sit down and talk about what we want. But what are the gentle ways that we can start conversations from people with culturally and linguistically diverse backgrounds, or just in general? So asking questions like, what do you value most in life? What does a good day look like to you? All of those things really help to understand what quality of life means for someone. And it does frame it really positively, rather than asking people, what decisions would you want to make if, for medical treatment? Or if you weren't able to communicate, what would you want? But thinking about positively, what values are important, what's important. If something happened, what would you want us to know? What would you want to happen? So thinking about really positive ways that we can focus on quality of life, rather than advanced care planning only focusing on end of life and death, can be a really nice way to get people involved in conversations. And these are available on the Advanced Care Planning Australia website and printable versions. We've often printed these in A4 and put them in key areas, waiting rooms, on the back of toilet doors. It gets people thinking about those things before we actually ask them, and can start that process for them as well, or for families. So Selene's team and Multicultural Communities Council of Illawarra have also looked at a whole range of videos of how to actually introduce the conversation, and some videos on how to start this with family members. So we've just got an example of the Turkish video, and we'll just play this conversation for you as well.
Melahaten kızı Funda. Bazı şeyleri konuşmak zordur.
Geçen sene kemoterapi geçirirken bana hastaneden verdiler ve gerçekten çok duygulanarak okudum, çok duygulanarak yaptım ama dolduramadım.
Üçümüzden biri hayatımızın sonunda kendi sağlığımız ile ilgili kararlarımızı veremeyeceğiz.
Ama bu hepimiz için zor olacak zaten. Yani ya da bana bir şey olduğu zaman senin için de zor olacak yani. Bu hayat, o yüzden böyle düşünmemek gerekiyor.
Kağıt üzerinde dolduktan sonra en az biliyoruz birbirimizin ne istediğini, son şeyimiz.
Advanced Care Directive, sağlık ile ilgili tercihlerinizin sevdiklerinizin tarafından bilinmesini kolaylaştırır.
Arada konuşulabilir ama her gün konuşulacak bir konu değil, çünkü çok duygusallaşıyor insan ister istemez. Ölüm, hastalık düşünmek istemiyorsun. Hayatın iyi taraflarına da bakmak istiyorsun.
Bunu konuşmak, sevdiklerinizi sizin adınıza tercih yapma stresinden kurtarır.
Bunun hakkında konuşmayı açmak için iyi bir fırsat. Çünkü bir form var ve ben senin elinde görsem, aman bu ne, bakayım deyip elindeki forma bakıp böyle bir şey de varmış, böyle sen ne düşünüyorsun? Ölümün ya da bu duruma gelmenin herhangi bir yaşı yok.
Evet.
Bugün benim de başıma gelebilir. Herhangi bir trafik kazasında, herhangi bir şeyde.
Evet.
Ben de göz atmak istiyorum. Dediğim gibi bu hemen karar verilebilecek bir şey değil. Ama en azından aklımda bulunup, forma bakıp ne yapmam gerektiğini düşünebilirim.
Evet, halen benimki bekliyor, yarı dolmuş. Çekmecede bir ara beraber bakabiliriz.
Evet.
Bugün bu konuşmayı başlatmak için doğru zaman.
Selene, did you have any comments on the videos or that process? I know you've been involved in it.
I was just going to say, as I mentioned, like it's an ongoing process. Like I think it's like we start like still trying to give the information. How important is that? So it takes time sometimes, but I think that we really need to non-stop, like the bringing up like the importance of the advanced care planning, why is important. So I just wanted to say it's ongoing. So like, and then it's not an easy thing, like especially like I'm working with the multicultural communities, like we are talking about all the taboos and some the behaviors, like just coming from the cultural behaviors as well. So it's difficult to, we are not trying to change, but like we are just trying to give the other alternative and then information that they can make their own decisions. So it's not easy, I know, like if you're, like I'm sure some of you are working with the multicultural committees because of that you're at this webinar. So please don't give up, and and then we are here to help. So with any resources or anything like you need.
Thanks, Ellen. So these videos are available on the MCCI website. They will be linked on the Advanced Care Planning Australia website as well. And we also have written resources in 17 different languages to support this as well, for individuals, for families, and also for healthcare workers or care workers who might be from a different cultural background as well, to give them information on advanced care planning. So what is your role as a healthcare worker if you are working with people from culturally and linguistically diverse backgrounds? Really, it involves communicating with the person and their family. So understanding what is important to them, what their values are, what their preferences are. Have they been introduced to advanced care planning? Explaining it really simply to them. It's also really important to make sure that the team is aware of the conversations, that it's a whole team approach, that they're all aware of what's important, that they're communicating on where they're up to so that everybody's on the same page. That we continue to communicate over time as well, that it's not a one-off conversation, as Selene and I have both mentioned. But also when we're working with culturally and linguistically diverse communities, sometimes they need a health professional to be an advocate for them and to really, especially if we are understanding their preferences, to advocate for them to be involved in the decisions, to advocate to use an interpreter to make sure that they're aware, to advocate for them to identify the person that they want to be their decision maker. Because often, for people with culturally and linguistically diverse backgrounds, they're kind of dragged along, and it is it's not unusual for them to just follow what the medical pathway is and be dragged along in their treatment. So it's really important for us to advocate for them to be the centre of their care and to always go back to what it is that they want. So the conversations, what happens after we develop them, it's really important that we share these conversations. And there was a bit of discussion around whether lawyers need to be involved. And advanced care directives and advanced care planning documents are really no use to anybody when they're sitting locked up in a lawyer's office with their will. They need to be accessible. So they need to be shared, copies need to be given. I always encourage people to give copies out to their decision maker, to their family, to their friends, that it's uploaded onto My Health Record and shared with everybody involved in their care, but that it is really shared amongst the family as well. So the time to find out that, your sister's appointed as the decision maker over yourself is not at the bedside. It's not when you get the call from the facility that something's happened. It's now. Everybody should understand their roles, and especially with cultural backgrounds, with the diversity in the community, with all of the complex issues that are happening, everybody should understand what their role is if the time comes and what they're going to play. So being upfront with all of those things is really helpful rather than having the conflict later. So I just want to acknowledge that there are complex issues with advanced care planning, and there is the potential for conflict. So from different cultural backgrounds, there can be conflict in determining who the substitute decision maker is or who's going to make those decisions. I was in a session once and a lady from an African background said to me, well, that's great that that's what the law says, but in my culture, the family will make the decision. It doesn't matter who's appointed legally, the family is going to make that decision. So there are sometimes complexities in determining the substitute decision maker. There can be differences between religious and cultural beliefs about the role of the individual, the role of religious leaders, and how that process will work and what the values and preferences are. Sometimes from particular cultural backgrounds, they want to demand futile treatment, and they might use advanced care planning as part of that process to demand treatment because they want all treatment options, which isn't possible. It's really important to consider informed consent and thinking that people understand the treatments that they're undergoing and they're providing consent for them. And there can also be the use of coercion or manipulation, and that can be more complicated or further heightened if somebody is non-English speaking. And the use of interpreters is really important to make sure that there's that informed consent and that people are understanding the decisions that they're making. But I think a really important aspect of working from people with culturally and linguistically diverse backgrounds is managing our own moral distress as health professionals. So sometimes if somebody makes a decision that we don't necessarily agree with, or it's not a choice that we would make for ourselves, that causes distress and moral distress, and we can often go down a pathway of trying to change their minds or convince them. But the first step is recognizing what our own values are, where they're coming from, and understanding that that distress is caused because this person is making a decision that doesn't align with my own values and how I manage that. And that it's because of their own cultural background, their own experiences that they might be making those decisions, and respecting that. So even though there are a lot of complex issues associated with advanced care planning, you might now be thinking, oh, I don't want to touch it because there's all these minefields that I might not be able to manage. But really, our role is not to solve these complex issues. We don't need to determine who the decision maker is. We don't need to understand, how the religious leaders play a role. What we need to do is bring the right people together and ask those questions and allow them to facilitate those discussions and come up with those answers themselves. So be involved in the process and make sure you're bringing the right people together and give them the space to have these conversations. So in summary, advanced care planning is person-centred. That's supported by advanced care directives, which document goals, values, beliefs and preferences, and it's all supported by a legal framework. And we really hope that you understand it's an ongoing process, ongoing communication and reflection. So for more information, the Advanced Care Planning Australia website has all the forms for each state and territory for particular health services and organisations, as well as information in 17 different languages and a whole range of other resources and videos. We also have our learning site, which has 11 free online modules, cultural diversity being one of those as well, that you can access for free, and our support service. So that phone number is available to give out to families, to individuals, but also for health professionals. So if you have a question, if you want to know what the process might be for particular situations, feel free to call as well, or hand that number out to clients. You can also refer your clients to us. So there might be some clients who want to participate in advanced care planning, but we know that it can be a time-consuming process. So you can refer them to us and we can step them through the process, understand what it is that they want to do and what aspect they want to be involved in, and really support them, and then get them to come back to you with, for example, completed forms for you to witness if that's what they want to be involved in. And to stay up to date with any of the relevant legal changes or any of our relevant resources and information, you can also subscribe to our newsletter. There's also the link there for the Multicultural Communities of Illawarra website. Celine, did you want to talk about what's available on there? There's some wonderful.
Yeah. So I just, I think I just put the link on the chat, like you can go in and have a look as well. But I just want to mention that this the Planning Ahead booklet is 17 languages, and then we are adding more languages in it at the moment. Because like we know, like there are lots of information, like this is like mainly, yes, for the support workers or any of the the people in the sector, but mainly for the communities, because specifically for the multicultural communities, that there are sometimes that they are not everyone, especially coming like, the older people, I can say that they are not very tech savvy. Again, I'm generalizing at the moment. So, and then like all the information is a little bit spread out. And then sometimes I am having difficulties to find the right information, to be honest. So what we done, like there is no new information in it. Like we just brought what is available in the sector, specifically from the Advanced Care Planning Australia. So we are just giving the people where they can go and then find the right information. So, and then like we just put in the different languages. And then like you can have a look the other resources like we have, like especially like if you're working with the multicultural communities. So we have a Bridging Cultures booklet. So that gives like the little bit the general information about the different cultures and then like their perspective about, for example, end of life care, about the family values or something. But like you just go and then that just browse a little bit in the website, like you will find the resources. If you can't reach them, you can reach us and then we can provide it for you. And also we have, like, which we are using, as I mentioned, the virtual reality technology for all trainings, like, because like we are delivering culturally inclusive service model training for the multicultural perspective on the palliative care or advanced care planning. So today, like, we just gave it a little bit, the sense of like what we are doing, but we usually, like, normally we are going in deep and then, looking at the cultures specifically, and then how we can work with the cultures. So this is like, we developed the virtual reality, which we are using through the training sessions as well. The idea is just giving you to deepen awarenesses and understanding of other people's experiences, and also support cultural competency in palliative care and end-of-life care conversation, and demonstrate strategies to improve communication with people from the CULT backgrounds. And again, like all these, the projects since 2018, like I just want to the special thank to Coordinate as well, and their patient and then their support too. So with their support, like we are able to do all these projects and then working with the multicultural communities. And I think questions.
Thank you, Selene. And I also just wanted to say that the Advanced Care Planning Australia support service also links with interpreters. So if you do give that number to multicultural communities, they're able to access an interpreter over the phone, and we're able to link them in. So we're able to provide that culturally appropriate advice in other languages as well. So I'll open it up if anybody has any questions in the chat. We do have a couple of minutes left. There was a question that came through from Tracy earlier in the presentation that I've just noted down. So Tracy's just asked, what is the difference between advanced care directive and enduring power of attorney? So it's a bit of a complex question depending on what state you're in as well. But just to clarify, the Advanced Care Directive allows you to appoint a decision maker for your medical treatments. So to make decisions based on medical treatment. However, an enduring power of attorney can often be for other things other than just medical treatment and healthcare. You can often have an enduring power of attorney for financial decisions, or for finances, to manage those bits and pieces. But anything to do with medical treatment decisions doesn't need to be done with a lawyer, and can just, the forms be downloaded from the website and completed by the person and witnessed.
Helena, it's Anna. There was another question earlier from Magnolia, and it was, how do you deal with the code of silence from certain cultures where the dying talk is taboo, and where family wants to hide prognosis from a dying patient?
Right. I can say something for that. Like, I think to maintain, when we are looking at the end of life and palliative care, so maintain the patient's autonomies in the best possible way by keeping in line with their cultural values and beliefs. So informed consent and truth telling is often sometimes maybe odds with beliefs and values in some cultural groups, and like we really need to be mindful of that knowledge as well. So ethical the dilemmas regarding the autonomy and disclosures that can be avoided by simply asking the patient. So if they would like to defer, or they handle the consultation by themselves. So, and I think it's also important to raise awareness is a little bit with the carers, and then who's making the decision for that individual as well, because as we mentioned, like in the decision-making process, the families and then like the circles are really involved in the decision-making process. Maybe we really need to raise awareness as why is important for that individual, that like the autonomy is important. And similar thing happened in my family, actually. Like my mom, like I lost my grandma who raised me, and I lost her with cancer. And then my mom, because it's in the families, and like when I lost my uncle, like my grandma didn't want to tell him. And then like when it happened to her, so my mom didn't want to tell him because like she thought it made her upset. But like so before she died, like maybe she wanted to say, like to do something special, or like maybe she like wanted to say farewell to us individually in a different way. So it's important to raise that, like why it could be important for that person, like who is dying. So not just with that person, yes, like we really need to simply asking the patient, but also we really need to work with their circle as well, like why it is important to telling the person as well. So this is my answer. Helena, maybe you want to mention something too.
No, thank you, Selene. Yes, I think it's really important, as Selene said, that we get consent from the person, maybe not by telling them what it is, but by saying, would you like to be involved? What information would you like to know? Yeah. And then being guided by them. That's a really good opening question. And if they do want to defer those decisions, that's documented really clearly, but that they have a choice in being involved, and that's our legal responsibility. We're almost on time, but there was one question from Sarah, and if there are any others, please either call or email the number on your screen. But the question was, if someone wants to have their instructions around medical options, do they need to be discussed with a doctor or witnessed for capacity, especially around matters for CPR? So in some states and territories, the advanced care directing forms do need to be witnessed by a doctor and signed by a doctor. Victoria is one of those that you're in, Sarah. They do need to be signed off by a health professional, but in other states they don't. But we always encourage people to seek medical advice before they complete those legally binding medical treatment instructions. It's really important for people to understand what the impact of those decisions are on their care. So any other questions, feel free to call or email. But otherwise, on behalf of Selene and I, thank you very much for joining us today for this webinar, Multicultural Perspectives on Advanced Care Planning. We hope that you've taken away some really valuable information to use in your practice, or some resources that you can access. If there are any questions, feel free to call, email, or reach out to us. We're more than happy to assist you. But thank you so much for joining us, and have a lovely afternoon.